have questions even. I know it's fine. I know. Okay, such is the problem.
All right. It's also a lot worse in patients who are uninsured or underinsured because that makes it a lot more difficult to go get these tests, to schedule these tests, to follow up with doctors, to see people. So really important to kind of get plugged in with the system as much as you can to get these checks done every year. All right. So just generally, cancers, the way they work is you have a healthy cell, something happens to the DNA within the cell, and it becomes an abnormal cell. And that cell replicates and replicates and replicates, and it gets bigger, and that creates a cancer. We can't pick it up at that one cell level because we're made of billions of cells, but once it becomes something a little bit bigger, we're able to see. That's what we're able to usually see on a mammogram, which is usually a cluster of those abnormal cells, okay? And that's generally how it works. Breast cancers are similar, if you can think of them similar to like a prostate cancer, as in some of them respond to hormones, and so some of our treatments to treat breast cancer are also related to treating those hormones as well to stop the growth, right? Because if you're having hormones throughout your body, it's gonna allow that cancer to kind of grow and grow and grow. And so sometimes stopping them or blocking those receptors allows that cancer to shrink or not grow anymore. So some cancers will be treated differently than others. What are the symptoms of breast cancer? We're telling you guys to be aware, but what should we look out for? Lumps, yeah. Lumps, should they be painful, not painful, both, anything? Yeah, you should be, any changes in your body you should definitely be aware of. So if something's new and you're not sure what's going on, you should definitely check it out because you shouldn't really have any painful lumps. Some people, when they get their periods, they get these kind of cysts within their breasts that cause some discomfort and pain, and that can happen every month, and they might just tell you to track that. But you wanna make sure you don't have any infections, you wanna make sure it's not cancerous. A lot of times we pick these things up incidentally. Anything else? What if one side just starts getting bigger than the other? Or the shape changes, right? The skin color changes on the area. There's any drainage when there's not supposed to be drainage, right? All those things that should make us a little bit concerned that something more sinister is going on underneath. So any changes, you should really check in with your doctor. Whether that's going to your primary care doctor, your GYN, the emergency department, wherever you choose to go, you should see someone for that sooner than later. And sometimes it's helpful to take a picture to know if it's gotten better or worse or stayed the same. This way you can kind of track how things are going. Does that make sense? All right. So we kind of talked about risk factors. What do we think puts people at risk for breast cancer? What about male or female? Okay, female, yeah. What about age? Right, more common once you get over 50, but definitely can happen when you're younger. Yes. There are certain genetic changes that happen, something called BRCA genes. Sometimes families have history of multiple cancers, colon, ovarian. Sometimes those make you a little bit more prone to having another type of cancer as well. If you BRCA, BRCA, and those make you a little bit more prone to having other types of cancers. So if you have a strong family history of multiple cancers, especially when they get diagnosed at a young age, I would say less than 40, you want to be a little bit more concerned, a little bit more cautious. Tell your doctors that for sure, because they might start all your testing for these cancers a little bit earlier. And a lot of times that's what needs to happen. So for example, one of my friend's mothers died of colon cancer when she was in her 40s. So my friend was in her 20s at the time, was getting colonoscopies. Usually that's not recommended till much later, but because of her family risk factor, you need to be sure sooner, okay? So that's really, really important. What about if you have a family member with cancer? Yes? Risk factor? Yeah, but like close family, right? Sister, father, brother, mother. If you have more distant, like cousins or something else with cancers, less likely to affect you immediately, okay? Interestingly, if you get your first period before 12, or you're going to menopause later, those are also increase your risk of breast cancer. Or if you're having your first child at an older age, old age in obstetrics and stuff is kind of like over 35 or over 40 for sure, okay? Or never giving birth at all also increases your risk for breast cancer, which you should not have a baby just to reduce your risk, but yes. All right. Lack of physical activity, sedentary lifestyle, not moving your body. They say, 20 minutes a day at least. We live in New York, we all walk a lot. Lack of physical activity also increases your risk as well. Diets in high saturated fats with no fruits, no vegetables, can also increase your risk as well. So all the things we kind of always talk about, like eating healthy, staying moving around, all those things can decrease your risk. Drinking alcohol, having previous radiation to the chest, if you had like a lung cancer or something else, sometimes can increase your risk for developing a breast cancer. Because where you might damage some of that DNA, create that new cell, which creates a new type of cancer within the breast tissue itself. Have you guys heard of hormone replacement therapy? Sometimes women take it after menopause to help with their symptoms of menopause, so you don't get the hot flashes. And it's basically like an estrogen-like pill that helps to decrease your symptoms. A lot of women were taking this for a very long time. Some people are still taking it now, but that actually increases your risk of breast cancer as well. It also increases your risk of blood clots, and a whole cardiovascular, a whole bunch of things. So it's not really recommended as much anymore, but some women out there are still taking it. So I just wanted you guys to be aware just in case anyone was taking it, okay? So those are all the things we can do. That some of them we can modify, some of them we can't modify. But things you can do is, try and be healthy, active, try not to drink any alcohol. Breastfeeding is actually protective. So it helps prevent breast cancer, or it's one of the protective factors. That being said, not everyone is able to breastfeed, and it's difficult for some women to breastfeed, so don't push yourself to do something you're unable to do, but it is one of those things to think about when you're considering why you should do this versus the other one. Hi. All right, so what are our tests for this? How do we check for this? What do we do to check for breast cancer? In the shower. Exam. Perfect. Where else can you do it anywhere else? Just in the shower? On the bed. When you're lying in bed with your arm kind of up, right? And you check all into the your armpit as well, okay? Kind of all the way down and around, and same with the other side. How often should you do that? Huh? Every day. I like the commitment. I don't think everyone's gonna do it every day. What do we think? Once? You can do it however much you want. They recommend saying once a month. The reason why they say once a month is because, especially if you're still getting your menses and your periods, your breast may change throughout the month. So if you check at the same time every month when you get your periods, then you should get the most consistent exam. So they say once a month. All right, so that's something we can do at home, shower, bed, wherever. What else can we do? Any other tests? You can check with a specialist. Mammogram. What's a mammogram? Yeah, it's like a special X-ray where they put the beam down and they take a look inside. Sonogram, excellent. So one of the things we say is if you are under 35 and you have some type of issue and maybe you noticed a lump or you had some bruising or something like that, we usually start with an ultrasound because the denser the breast tissue, a little bit more hard to read on the mammogram because it's kind of cutting through all those layers, so it's hard to see through. With the ultrasound, you can kind of get a direct view in one area, so you can kind of get more of an accurate visualization of what's going on when people are younger. When people are older, if you have an abnormal mammogram from denser breast tissue, sometimes they just say to repeat the mammogram, or they recommend an MRI sometimes, because that's going to give them clear-cut slices of, and pictures of what's going on, okay? How often should you get your mammogram? Yeah. So over 40, every 1 to 2 years. It's, if you've had completely normal exams for a long time, maybe they might stretch it out, okay? If you've had frequently abnormal exams, they might say every 6 months to come back and do it. X-ray is kind of like a low-dose radiation, so it's not like getting cancer radiation to your chest, so it's not as likely to cause a breast cancer. I know because I remember I said radiation before. Okay, great. You guys are doing great. Let's do some true or false questions. If you get an injury to your breast, you can develop cancer from that later on. Okay, let's go. Raise of hands for true. Raise of hands for false. It's actually false. Yeah. The injury itself doesn't cause breast cancer. What happens is sometimes you get imaging or something later on, and they might incidentally find it. Sometimes an injury can cause what we call calcification. So you get a bruise, and then it gets covered in calcium, so it gets a little bit hard, and people feel like a lump there, but it's not actually cancerous. It's just kind of your body's reaction to whatever happened in that area. Huh? After an injury or the cancer? Yes, absolutely. Yeah, it can definitely be painful. All right. Breast cancer is more common in women with bigger breasts. Okay, let's do raise of hands again. True? False? Okay, good. False. So there's not really a connection between size because you can be skinny, active, kind of doing all those protective factors, and just that might just be your body type. That doesn't necessarily increase your risk for cancers. If you have denser tissue, like we said, it might be a little bit more difficult for them to pick it up, but it doesn't increase your risk for developing it. Okay? All right. What about eating sugar causes breast cancer? Is that a thing? True? False? Okay. All right, we're on the fence at this one. Yeah. So not necessarily just eating sugar. Obviously, being overweight and obese and not having an active lifestyle, those things itself can cause, can lead to increased risk factors for cancer, but not necessarily cause it. So, eating 1 pack of gummy worms is okay. All those other things kind of increase your risk. Okay? All right. This is one I heard for a long time. Carrying a phone in your bra or on your chest pocket can cause breast cancer. I know, everyone has heard this. I was told this too. Yeah. All right, let's do this. True? All right, false? Okay, so they did some studies on this to check. They didn't see any connection between phone use and cancer, but they're continuing to monitor. So, but as of right now, we don't have any data that says that is a connection, okay? So if you want to keep your phone here for now, that's okay, all right? If you want to, that's up to you, that's up to you. All right, good. Okay, what about underwire bras? Do those cause breast cancer? That is what they say. What do we think? What do we think? True? False? Okay, it's false. No connection. Yes, please. Mm-hmm. It's one of the,
I used to research cause cancer.
so an underwire itself isn't, maybe the pressure and like, based on this, I looked through the studies, I didn't see any link unless something came out recently.
Said, doctor, last week I saw a realistic
From, where?
on the television.
Which channel? Just kidding. No, I'm just kidding. The studies that are currently out there don't really show any risk. A wire itself is unless the wire itself shouldn't cause any cancer, right? It's just a piece of metal kind of outside your body. There's nothing else attached to it, and it also depends on how your bras are fitting as well, which is a whole separate topic. Which may be like if you had some increased trauma or pain or something, then maybe they're doing more screening tests to then pick up more cancers in patients as well. So I think when we hear something like that, we have to think, what are some other causes behind this? And because nothing is in a vacuum, right? So is it just that everyone had the exact same risk factors and does the same things every day, and then just one person happens to wear a wire bra and one person doesn't? Or you have to think like, are the people who are wearing wire bras need more support? And is it because they're bigger people and that they have those other risk factors of obesity, or maybe it's something in their lifestyle? So nothing is ever in a vacuum, and that's why a lot of these are false, because no one is doing one of those things. They're probably doing a lot of different things. So while I believe he said that on TV, I'm sure, we have to kind of think of all the other factors of who are the people that are wearing underwire bras.
I even went to look too underwire on.
Yeah, yeah, and so, it's you have to think of the type of people who would need an underwire bra. The people who are not wearing underwire bras, which who knows, anyone can not wear an underwire bra, but sometimes those people need less support than the other people, and maybe that's because of how their body is shaped. And so I think you have to kind of think of now we talked about how many risk factors there are. A lot of those things overlap. And so is it just that this is one of those things that's also overlapping with those as opposed to being a direct cause? Does that make sense? Okay. That was my next question. Do deodorants cause breast cancer? Maybe. I like that. Sturdily on the fence. I like that.
Depends on what chemical what made the deodorant, I would say.
So, I mean, the studies so far don't show anything. I think a lot of people have moved to like aluminum-free deodorant, primarily because that doesn't clog your pores or anything underneath the skin. But that means it's not an antiperspirant. It's just like a good smell as opposed to stopping people from sweating. The previous studies showed that deodorants didn't cause, but every data changes all the time. So I'm sure something can come out in 2 years that's like, it's like eggs. Like we should eat eggs, we shouldn't eat eggs, we should eat eggs. Everything changes all the time. So yes. So like I said, it can block a lot of the pores. Was she having like infection under the arm? So those things can happen actually quite frequently, and I'll talk about it for a little bit. Deodorants, like I said, if you use an antiperspirant, the way it stops the sweating is that it's basically clogs the pores a little bit so you don't secrete sweat in that area. Which if you're clogging pores, just like if you clog pores on your face, you can get a pimple, you can get bacteria. But if it's under your arm, and you think about your arms like this most of the time, you're sweating and you're having increased bacteria to that area, right? Because you're secreting a whole bunch of stuff from other areas, and your clothes are rubbing here almost all the time. So that's going to increase your risk of infection under your arm. Some people are more prone to infections, and that's under the arm, usually in the groin or in the bottom. And those people tend to get recurrent infections. So sometimes, it's particularly for people who get those recurrent infections, they tell them not to put anything there because that's going to increase their risk of getting increased infections. And also, your deodorant stick, you're rubbing it, you're putting it down, and then maybe you're sweaty one day, you're not sweaty the other day. Your bacteria will stay there, and then you're rubbing it into your armpit again. So not to say don't wear deodorant, but just like all the things, if you're prone to getting those infections, then that would be one of the reasons why as well. Okay? All right. True, false, all lumps are cancer. Okay, what else could they be? If it's not cancer, a cyst, good. What else? Yes, yep. Benign, excellent. It could also be infection, right? Sometimes, especially in our younger patients, we have a lot of women come in with infections. Sometimes can happen when people are breastfeeding. And maybe it's from the duct, maybe it's from the gland, but you might just get some redness on the skin and then feel a lump underneath. Sometimes that's a collection of an infection, and that's called an abscess. And then last one, can you get cancer during pregnancy? I'm going to take this nodding here as a yes. What do you guys think? Can you get cancer in pregnancy? Or should you just be pregnant all the time and protect yourself? Can you get breast cancer during pregnancy?
Breast cancer can come anytime?
Yes, it can come anytime. I like that. So when people are getting their checks during their pregnancy, they might notice that they're like, oh, actually I have this lump that I didn't really notice before. You can absolutely be diagnosed with breast cancer during pregnancy. Whether you decide to do whatever treatment for that during the pregnancy will be based on the cancer, based on that individual person, how far along they are in their pregnancy, but it can definitely be diagnosed, okay? Okay, perfect. And only a small amount of lumps actually end up being cancer. So a lot of lumps are either benign, they're cysts, they're infection, they're something else, okay? So what is our treatment for cancer? Chemo, okay. Anything else? Radiation, good. Anything else? Any surgeries? Mastectomy? Yeah, so there's lots of, anything that ends in ectomy basically means we're taking it off. So a lumpectomy would be removing the lump, and a mastectomy would be removing the breast tissue. So sometimes people get one side done, sometimes people get both, even if they don't have the cancer yet because they have a strong family history. Yeah.
If you have it in one
Yes.
and I took it off,
Yes.
would it be advisable to take two off at the same time then, instead of going to realize that maybe go to the other one?
If you want.
Yeah, it depends, right? So if it's a little area that's like, like this big, maybe they just say we'll just take off this little area right here. A small cut, take it out. If you have, say, your sister and your mother and whoever else had cancer as well, breast cancer, they might say, actually, it's better to take both off because you're likely because you have it in one, you can get it in the other. If you do one, your chances of getting breast cancer in the other are higher because just having that cancer before makes you predisposed, right? Because again, you just need that one abnormal cell to then proliferate and make another tumor. So that would be a discussion with whoever is doing the procedure and based on what type of cancer it is.
And I have another thing.
Mm-hmm.
Last year when I did my
Mm-hmm.
then they sent me back a letter saying that with the left breast, like there seemed like some abnormality, but they said they have to do a further one. So they had sent me to another place in Monty where I had to go do a sonogram this time.
Mm-hmm.
And at the sonogram, then after the sonogram, the doctor said to me, where did I take my vaccine? If I took them in my left shoulder, because it was the left. And I told her, yes, I took all the vaccine in the left.
The COVID
And she
vaccine?
said, right. So I think she said, I don't remember the word she used because she sent the result to the doctor. But it wasn't any cancerous or anything. But it was because of the vaccines that I'd taken in. I don't know if it said some abnormality or something.
Did the doctor say that to you?
Yes, the lady that did the sonogram.
So the person who
She
did the
asked me where did I take my vaccines.
Right. I just want to be sorry. I don't mean to cut you off.
Sure.
Was it the person who just did the ultrasound or the doctor who came in to talk with you about the results?
I think it's the doctor who came in. Because after she did sonogram, the doctor came in and then she asked me, where did I take all my vaccines? I told her in my left arm.
Okay, I'm gonna say something. That's not evidence-based medicine. There's no science to prove that, right?
No, she said vaccine caused it, but maybe, I don't know what she asked.
But yeah, that's not usually related, right? The only thing that if you got a recent vaccine, maybe you're like you have a a little bit of symptoms and your lymph nodes are a little bit swollen. That's as most as it could be. But the vaccine and trying to link it to any type of like mass or something like that is not science-based. Yeah, which I don't know why she asked you that, which is why I was trying to figure out who asked you that question specifically. Sometimes some providers will say something who's just doing the ultrasound, or it's the person who's coming in. But if someone asks you like that, just feel free to ask the doctor to be like, hey, that person said this thing.
I did ask my primary doctor.
Okay, yeah, but there's no link to that right now. But that's a good, thank you for bringing that up. I appreciate that. Okay, the last thing I want to bring up is the last treatments. There's a lot of new treatments actually. One of the things for breast cancer, like I was talking about before, is that they are hormonally based. So sometimes they respond to estrogen or progesterone or another hormone as well. What we can do is then kind of lower those hormones. It stops the cancer from growing. So that's a kind of another treatment. We talked about surgery, radiation, chemo, and hormonal therapy as well. Okay, they have another type of therapy that's new, like immunotherapy. That's very specific to like cancers and those type of things. So there's well, not a million, but there are a lot of types of cancers, and it's going to be dependent on that biopsy that we talked about, where they put that little needle in and they take a look and they get a little piece of the tissue, so they can say, what is this cancer, how far is it spread, and what type of treatment would be best for you. Okay, so it's really going to depend on the size and the stage and the type. For Black women, we have a higher rate of having what we call triple negative breast cancer. Has anyone ever heard that term? Triple negative. It means they don't respond to any of those hormonal treatments. So there's like 3 hormones that we check, and sometimes being on those hormonal treatments will stop the growth and will stop the spread. But a lot of times we have what we call triple negative, which means it won't respond to any of those. So that's not an option for treatment a lot of times, which is why it's really important to kind of get these things diagnosed early, because that's definitely something we would want to take out when it's small as opposed to when it's much bigger. Okay? Any questions? Yeah.
If a person chooses to remove the breast,
Mm-hmm.
is there anything we reconstruction?
With reconstruction?
Yeah.
Yeah, so that's a great question. So breast reconstruction, that's probably a whole nother talk, but the idea of a mastectomy is to kind of remove all the tissue within the breast and sometimes the nipple, which can also have cancerous cells in it as well. So sometimes they remove everything, or sometimes they leave part of it. With the reconstruction, which depends on what type you get, but let's just say for an instance an implant, there are regular concerns like infection, recurrence. You can still get recurrence if there's, again, it's just a couple cells that need to survive, which is why they kind of do all these markers. And you can still pick that up within having a mastectomy and a reconstruction as well. There you can get some drainage and other things post-operatively, but generally because it's such a common procedure right now, and people get them done wherever it's cheapest a lot of times, the risks have been minimized a lot, so a lot of people just come out and do fine. Okay.
Good morning. Good to have you with us, Doctor. God bless you. I have a comment and also a question.
Yeah.
The comment is a comment about the relevance of something like this, especially to mixed audience, young, old, male, female. I listened to a speech yesterday, and the speaker was saying how a lot of men are divorced from this question of, breast cancer, and they don't want to hear it and all that kind of stuff. And I thought it was so relevant for us to have this morning, because whilst in your presentation you mentioned the prevalence among women, this affects men also, not only personally, but in a second-hand way. I mean, with our wives, our sisters, our mothers, our grandmothers, the female in our lives. And so I think this is so relevant that we pay attention to this as a means of support. And while it may not affect us personally, but the support system is needed. So that's a plug for the for having a mixed audience with this kind of education presented, so that nobody can say, well, oh, that's a woman's issue and it's a man's issue. It's really affect all of us. My question, though, has to do with, you mentioned the fact that physical activity is very good and it's part of keeping one's body active and everything. But I'm throwing you a loop here. What do you think about women in high contact sports? Although you did mention that, not necessary, but real high contact sports, and also in combat, you know, going serving military and in those situations. What's your view on that down the line? Women in combat and also women in high contact, intense contact sports.
Yeah.
Do you think it increased likelihood or what?
I don't think it increases the likelihood. I think maybe if you had an injury, it might increase the chance of them picking up something. But personally, I think if you want to serve or you want to play high contact sports, and that's a decision that's totally up to you. And I think if that's something you enjoy and it makes you happy, then I think that's fine. It shouldn't increase the risk of developing any type of breast cancer. But I do think that physical activity is good for you. And so I think everyone finds their joy from doing different things. So if someone likes to do something, an activity that's viewed as maybe high contact or strenuous, and that brings them joy and happiness, I feel like that's just fine. Maybe I'm an unpopular opinion, but yeah. I think it's up to the person. I don't do anything you don't want to do, but if that's something you would enjoy, then I think it's fine. Any other questions? Yeah.
I have a close family friend that was diagnosed with breast cancer.
Mm-hmm.
Do all the treatments, went into remission. After about 10, 20 years, it came back and cut the person off so fast back. Why is the cause that it came back?
It just takes a little bit to survive for the chance of it coming back, unfortunately. Like I said, it's when you have it once, you have a higher risk of it returning in the future, which is why they always recommend doing follow-up scans and continuing your treatment. The reasons, cancer causes a whole host of other problems besides the direct cancer. So I'm not sure what happened to your friend, and I'm sorry. I think what happens is sometimes the complications of the cancer itself are what cause a lot of mortality as opposed to directly from the cancer, if that makes sense. So if it came back and it was, we say stage 1, it's just an isolated lump, that's not as much of a big deal. But lots of times, especially in my job, people have cancer 20 years ago and they come in for something either unrelated or a complication of a cancer that they didn't know that came back. And then I'm the one to tell them, And so I think what you have to think about is the fact that once you have it once, you have to kind of follow up with all your doctors forever, which may seem silly 10, 20 years down the line. You're like, why am I still seeing this person? I've been good for so long. The reason is to kind of pick up those clues a little bit earlier, to kind of get on the treatment a little bit earlier. And that goes for all cancers, including like colon cancers and polyps, things that have been removed. You want to make sure that things don't come back and then progress. And so sometimes what happens is people get lost to follow up. I'm not saying that's what happened specifically here. But if you get lost to kind of follow up down the line, we really have difficulty kind of picking it up because there's not really anything else that's going to look, if you're not getting like a CAT scan of your chest for something else, that will pick this up in a timely manner and do that diagnostic treatment and management early. So that's why once it's diagnosed, definitely follow up for all cancers, and this goes forever. Even if you're feeling well, it'll just be one appointment a year, just to see somebody. And the same thing goes for things like prostate cancer as well, which is, I'll just mention it here, that it is a slow cancer. Most people don't die directly from prostate cancer, but they might have symptoms for a long time. And then they might get treated, might feel fine, and then it kind of just dwells along for a long time, and sometimes they'll come in for something else, like a hip fracture, or they fell or they tripped, and then they find out that the cancer had moved from their prostate to their pelvis or something, or to their hip. So I think the reason for follow-up is to kind of monitor these things to make sure they don't go unchecked, and that's for anything. Yeah.
How do men check themselves for breast cancer?
Same way as women.
They demonstrate.
You want me to, okay. Going to church. So you're in the shower, you either put one arm up, or you lay down on the bed with your arm kind of back, and you basically just like rub in a straight line and cover all areas. And then when you go around the breast, you kind of go in a clockwise or a counterclockwise position, but you make sure you cover all the tissue, and you just kind of feel all the way along. Sometimes partners pick this up in their spouse. I'll just leave that there. But someone else picks it up as opposed to the patient themselves. And they said, this is new, I'd never noticed I had this before. And then they follow up from there. But the exam is exactly the same for men. And you can get, like fat tissue can become a little like chunky sometimes. And sometimes people can feel like that is a cancer. But the best option is to get it checked as opposed to leaving it unchecked, because it's much easier to treat when it's just that little clump as opposed to when it's much more spread. Okay, yeah.
Do they have the same mammogram as us?
For men,
Yeah.
it's a little bit harder to get the tissue kind of like in the machine. So for them, they might do an no, yeah, it's a good. I think it depends on the patient's body habitus and if it's easier to do with an ultrasound or an MRI to see the tissue there, because it's a little bit harder to do with the mammogram. Yeah.
The women that do the breast enlargements and breast implants, is it a risk for breast cancer?
No, it might be a little bit hard if they don't follow up to get follow-up for it. It might be a little bit harder to see. It also might be that they either they put something in that's kind of obscuring the tissue, so it makes it a little harder to see, but not necessarily a risk in and of itself. Yeah. And there's so many different surgeries now, but and they do that after a mastectomy as well if someone wants an implant afterwards. So they have ways of screening now that they're very good at looking at checking and screening even for patients with implants. Anything else? All right, because a lot of us, remember I said it's 1 in 8 people, and of those cases, 1 in 100 men will be diagnosed as well. So the treatment for this, we said, is kind of chemo and radiation. What are some of the side effects you guys have heard of or seen with this? Hair loss is a big one that people see and talk about a lot. Anything else? Nausea, good, and vomiting? Anything else? Weight loss, yep. Sometimes people get like sores in their mouth, loss of appetite. It's hard for people to keep up their strength when they're on chemotherapy, especially if you're always nauseous and always vomiting. So important to kind of encourage or try to encourage people to eat and get some calories in to keep up their strength while they're going through these intense treatments. They might get something called brain fog, which is just kind of feeling cloudy all the time, depending on what kind of treatment they're getting as well. And then because some of those medications are hormone responsive, you might get symptoms that are similar to menopause. So whether that's difficulty conceiving, any type of fatigue, also the brain fog happens, hot flashes, those things might be related with that type of treatment too, okay? All right, so the last thing I'll say is it's really important to support whether it's you or someone else you know, to support them through this process. It's a difficult process. I think a lot of us probably know someone who's been diagnosed with a cancer or some type of chronic illness, and it feels as if your body is kind of giving up on you or has lied to you, and because you've maybe felt well all up until that point, and it can be a lot of mental burden. So having a good community around you to support you and kind of push you through the times when you're not feeling like doing this yourself is extremely, extremely important. As family and friends, we have to support our loved ones by helping them eat. A lot of this is going to be preventative, right? And for the younger members, staying active, eating healthy, doing as much as you can now to prevent this so you don't have to deal with this in the future. And if you're already there dealing with it in the future, kind of mitigating as much of the side effects and things as possible. And I know a lot of times it's hard to feel like upset when someone either doesn't want to do a treatment or doesn't want to do chemo or radiation and they just want to let it be. You have to kind of help them see all the benefits and pros and cons of everything. And if that's their decision, that's their decision. I think that's a personal choice that's up to everyone, but being a mental support system for someone else is super, super important through any type of chronic illness like this, because it's going to be a lifelong journey. And like I said, even if it's removed and everything is good, that encouraging them to keep following up, even though things seem good now, is super important. Okay. Anything else before I finish it?
In your practice,
Yeah.
age range of this disease attacking? Youngest, oldest, how does you see?
So, oldest can be any age.
Yes.
And usually those are incidental. They're here for something else. Youngest, I've seen like in their 30s, but can also happen in 20s depending on like family risk factors as well. But usually those people know, if that makes sense, because say their mother had this, their sister had this, it all happened at this age, and I noticed something, and that's why I came in today. A lot of times, especially from the emergency department standpoint, I just see people come in with a re-diagnosis. So, as in they were in remission for a long time, and they came in for something else, and we happened to find that their cancer came back, and how aggressive it is, and that happens a lot. And that happens through all ages. And that's obviously very difficult news to break, but it's better to get someone back on track with their treatment than have them not know what's going on. And again, that's a lot of a mental and emotional support as much as it is kind of a physical and support from the hospital. That patient needs a lot because they thought they were doing well, and I just told them they're kind of back at square one, and that's really difficult. So that's why I'm saying, especially in this community, to have that support system from you all, from anyone else who's going through this, for this or any type of cancer is immensely important, because I think it makes all the difference on who we see does well through this stuff and who doesn't.
What is your take on second opinion, and also, if you can you say which is one of the best places in our, if you can, compromise right, you could just give geographical region.
New York City, no, I'm just kidding.
Yeah, but, can you say that?
Yeah, I think second opinions are definitely useful, right? Especially if someone's recommending a very, very invasive procedure to you, you're not sure about it, have a second opinion. I personally, I can't say any places in particular, but when I tell my parents where to go, and they live in New Jersey, I always tell them to go to a teaching hospital, which is an academic center. So Mount Sinai, NYU, Cornell, Columbia, a hospital where they teach residents. And I say that because, one, that means they have probably all the specialists there in the hospital, which means if you start your care there and you need 6 other specialists, they're probably all in that system already, and it makes it very easy for you. The second thing is, when you're in residency and you're teaching at a hospital, you have to stay up to date on everything that is happening, and that is part of your job. And you want someone who's up to date on everything, who knows all the options, and who's not going to offer you something because this is the only thing that they can do at this hospital. They have all the resources, so if they say that actually this is not a very good plan for you, let me refer you to this person who's still in the system. They have much more resources to do that, and I think sometimes those second opinions at maybe a big institution is very, very helpful because they have that variety of resources. But any big academic center, I think, is where I would tell people to go, and that's where I tell my parents to go. And I think I've seen good care from them there. Yeah. Yeah. All right. That's all from me. Thank you, guys.
Thank you, Dr. Goodin, and of course, on behalf of the church, everyone here,